Welcome back, everyone, to the University of New Mexico Law and Mental Health Series, weekly discussions of practice and science featuring experts in behavioral health and the law. This is a series run by the Division of Forensic Behavioral Sciences of the University of New Mexico in our Department of Psychiatry and Behavioral Sciences, along with support of the New Mexico Behavioral Health Services Division. I'm Anthony Perillo, the Forensic Psychology Training Director here at the University of New Mexico. For our talk today, if you have any questions for our presenter, make sure you enter those in the Q&A box. You can enter those anytime that you feel comfortable, but do know that we hold questions until the end, and oftentimes it's not possible for us to get through all of them. In terms of continuing education credits, if you are pursuing continuing medical education credits, there's a sign-in sheet posted in the chat box now that you can use to start to receive your credit. For those of you that are pursuing APA continuing education credits, there will be a link to a survey that you'll complete for your credits in the chat box, but this link will be posted near the end of the webinar about 5 to 10 minutes before the hour, so keep your eye on the chat box near the top of the hour for that link. Make sure that you open, copy, bookmark, otherwise reserve that link before the webinar closes, and then make sure you save a copy of the certificate after you complete the survey as your proof of your CEU credits. If you missed our most recent talk in the series at the end of 2025, Dr. Douglas Lewis Jr.'s discussion of military behavioral health assessments and comparisons to forensic psychology assessments is now available on our YouTube channel. The recording for this week's talk will also be available on our YouTube channel sometime later this week, and a version of the slides for those that have registered for the series will be available later this week as well. As a heads up, next week's planned Law and Mental Health Series talk will need to be rescheduled for a later date. We will return the following week, January 20th. We have Dr. Colleen Berryessa discussing criminal legal outcomes for people with autism spectrum disorder. But circling back to this week, I'm excited to introduce you to today's speaker, who will be discussing applications of artificial intelligence to forensic psychology as part of a continuing discussion of use of AI in forensic psych practice. Today, we have Dr. Benjamin Silber. Dr. Benjamin Silber obtained a PhD in psychology at Loma Linda University and is a certified specialist in forensic psychology by the American Board of Professional Psychology. He recently joined the American Board of Forensic Psychology examination faculty and is licensed in Arkansas, Ohio, and through SIPACT. He's performed a range of criminal and civil forensic psychological evaluations during his prior employment at Arkansas State Hospital and NetCare, and in his current private practice, expert psychological evaluations. Dr. Silber has deep fascination with AI and technology and how they can be used and misused in the practice of psychology. In particular, Dr. Silber is interested in how AI can enhance efficiency and improve or diminish quality and accuracy, as well as the ethical considerations inherent to the use of AI in forensic psychology practice. So Dr. Silber, on behalf of the University of New Mexico, thank you for joining our series and bringing in 2026, and we're thankful for you sharing your expertise with us today. I'll go ahead and toss it over to you.
Well, thank you so much. I really appreciate it. Before I get started, I do want to say that I have no relevant financial relationships or commercial interest of any kind. Today, I'm actually going to specifically discuss certain AI companies or platforms. I'm discussing these merely as examples or demonstrations. I have no connection to any of them. I don't receive any financial reimbursement from any of them. And to be honest, I don't care if you use any of these platforms or any others in particular. It's only going to be used as illustrations for the purposes of this presentation. As far as my disclaimer goes, I just want to make sure that everyone is aware that the presentation today is really specifically only my personal views. This does not represent the University of New Mexico. I also want you to know that this presentation I'm doing today is actually part 3 of a 5-part AI and forensic psychology series that I'm doing with 4 of my co-presenters. Dr. Chrisman has already presented, and her presentation is already available on YouTube, and it's looking at some of the most foundational elements of AI and the practice of forensic psychology. Dr. Foreman did it next. She presented on a number of topics, but primarily, I think what is probably most important in preparing for my presentation today is she discusses some of the preliminary things you need to consider when you're deciding whether you should use AI in your practice of forensic psychology. She talks about preparation, some things related to ethics, some things that you need to do in terms of maybe policy or forms, records, and things of that nature. So if you have not watched those presentations, I highly encourage you to watch them because this presentation today is actually based on those prior presentations. Dr. Hodges will be presenting next, and he will be discussing the ethics of use of AI with forensic psychology, and Dr. Armstrong will be discussing this in more of a scientific research context. So stay tuned for those as well. They're very important to make sure you have a broader and fuller understanding of the use of AI with forensic psychology before or while you are actually using it in your practice. The five of us have also published an article that covers a lot of the important topics that we've been presenting about. So if you want this in a written format, certainly go ahead and check that out, and it will be helpful for you. My purpose of my presentation today, I'm going to be the demonstration presenter. In other words, I'm going to look at how can we practically apply what we've been talking about across this series to the actual practice of forensic psychology. So I will be describing applications of AI. I'm going to especially emphasize the demonstration of the use of AI and also weigh some of the pros and cons. Sometimes I've gotten some feedback when I've talked about AI and forensic psychology that what we discuss is too abstract. People want to see hands-on practical demonstrations of how to use it. They want very specific examples. So today, that's what we're going to be doing. In terms of actual ways to use AI, there are a vast multitude of ways to use it. Some of them are fairly straightforward. For example, if you were to use AI to create images or content for a website or a brochure or some kind of social media, I think that's a fairly straightforward use. It's already being used across many industries, and it's fairly low risk. As long as you are reviewing the content and ensuring that it's accurate, that it represents what you want it to represent, the risks for doing so are fairly low in terms of ethics and the law and other professional considerations. Some people are already using AI in other formats. For example, they're using it for referrals and initial contact or for scheduling and calendar management. And so some people are using AI in a manner that they are using standalone applications or they're using integrations with their websites. For example, you can create a private practice website with Wix, and that has integrations with AI management for calendar or for initial contact. There's a little bit more consideration in terms of ethics and the law for some of these issues if you're using AI to interface with potential patients or clients or defendants or claimants or whoever it is that you're actually interacting with in your practice. Something I think has a significant value to forensic psychology, and I think will increase in that value over time, is the use of AI for medical record review. Now, again, I highly encourage you to take a look at both Dr. Hodges and Dr. Foreman's presentations because they're going to talk about ethical considerations and preparation that you need to do in order to utilize AI for this purpose. For example, transparency, informing the appropriate individuals who need to know that you're using it for this purpose. But if you are able to use AI to review records, a great benefit of that is it is like a second set of eyes. It does not replace your review. You still need to, of course, be doing the review. You need to make sure that what the AI summarizes or what it identifies is accurate by actually looking at the primary source. But it can help you identify patterns more quickly, identify information more quickly. It can help you reorganize chronologies and disorganize records more quickly. It can help you catch things that you might have missed in your own review. I do a lot of private practice work, and it's not uncommon for me to get cases with 1,000 to even 20,000 pages of records. And it is not hard to miss things on my own. So if you have the ability to use AI to double check and to make sure that you are not missing important things, that has the potential for significant utility and efficiency. There are also HIPAA compliant platforms like TranscribeMe and Mentalic, which I have listed here on the slide. They will automatically transcribe audio into text. And so I will sometimes get cases in which I'm provided a case file that has 100 jail calls. And if any of you have experienced that before, you know it is a terrible feeling. Again, if you have permission and you have everything in place and you're able to use AI to transcribe all 100 audio files, that could be a significant time saver. A lot of these platforms will allow for timestamps for the transcripts. So if there are certain keywords or phrases in particular audio files, you can quickly go and listen to it yourself to verify that the person actually said what the transcription claims that they said. We're going to talk more about hallucinations later, but you should always be aware that there is an element of error in any tool that you use, and that is certainly true for AI. So you want to make sure that you are double checking everything. You can also use these kinds of platforms or these AI services for interviewing. In other words, you can use this to record during your interview. At the close of the interview, you will have a full, near perfect transcription of the interview. And it can also, of course, be used to summarize what was discussed. In terms of the near perfect nature, a lot of these platforms will say they have at least 90 or 95 or 97, 98% accuracy. That, of course, does not mean 100% accuracy. So if you are using this for your interviewing, I would highly encourage you to still take some notes, especially for really key quotes. There's always a possibility that the AI would inadvertently transcribe whatever it was that was said at that moment. So if there's a really important thing that the person is saying, I would still be taking notes simultaneously. But if you are the sort of person who struggles to write down everything, either you're very slow with writing or you're a slow typist and you can't keep up with a person, having AI transcribing as a second source is extremely helpful. It can help catch a lot of quotes or things that were said that you were not able to capture when you were taking notes, and it allows you to be more comprehensive. Another benefit is if the AI is performing well and you have a lot of confidence in it from your own test and your use of it, you may not have to write down everything. You may start being more selective with what you're writing down. You may start taking notes on things other than what is being said. For example, spending more time focusing on note taking for behavioral observations, spending more time thinking about questions you want to ask, or maybe building rapport with the individual. Solely is a HIPAA compliant AI. It's designed more for medical context, but certainly it can apply to mental health considerations as well. The benefit of this is in addition to listening in on the conversation, so to speak, it can actually make suggestions during the interview on what you might ask or certain things that you should be thinking about or suggesting potential diagnoses. As an example, an individual might say that they have a headache or they've been having problems with headaches. And you might think, well, that could be psychosomatic. Maybe that's anxiety related. Or you might think, it could be sleep deprivation, might be migraines. You might be thinking about different possible explanations. But then slowly might recommend or suggest to you that dehydration could also be an explanation. Caffeine withdrawal could be an explanation. Maybe they were drinking alcohol the night before. There's a lot of potential explanations. And so the hope is that this is going to be a tool that will further expand your considerations beyond what you might come up with on your own. AI could also be used for note taking. When I do my evaluations, I often go to different jails and prisons or hospitals, and I tend to travel quite a bit for some of those. And what I have historically done is on the drive home, I will dictate all of my thoughts from that evaluation into an encrypted email, which I'll send to myself. But you can use AI for the exact same purpose. And you can, if you have an AI that you're comfortable with that has HIPAA compliance, that has certain privacy and encryption security features in place, you could start using it for that same purpose. Based on the things that you're telling it. And you could tell it, again, your opinion, your support for your opinion, things that you'd like to ask collateral contacts, additional data that you need to gather maybe from records, things that you want to ask an attorney. And it's a great way of just keeping everything very organized for you and hopefully improving your organization and efficiency in your practice. You can also use it for training of students, and I've done this quite a bit, especially for students who have struggled early in their clinical training with clinical interviewing. So what you can essentially do is you ask the AI to role play with the student. You tell the AI to pretend to be a particular clinical presentation, and then you have the student interview back and forth with that AI. In the past, I have done a lot of role playing myself with students. I have students interview with me, ask me questions, but this is a great supplement. And of course, the AI is very responsive to feedback. So you can give it prompts or suggestions about how to present, and it generally does a pretty good job. You can also consider using AI to help simplify fairly complex concepts. Hyperwrite has a feature that does this. ChatGPT can do the same thing. So if you're going to be testifying and you know that a key issue for your case has to do with normative sampling or norms or something along that line, and you are kind of starting to rehearse for your for your testimony, and you realize that's actually kind of a difficult thing to explain to a jury. You could ask ChatGPT or Hyperwrite, can you explain this concept to a person who is a child? And it'll give you a great explanation, or maybe it doesn't. You can ask it for multiple explanations, and then you can pick information from that to help you when you're either teaching students or trying to teach a jury or someone else who may need complex subjects simplified. I've also used it a lot for testimony and self-reflection. We'll talk about bias later. A concern that we often have is that AI is going to have some bias in it, and that, of course, might mislead us. But you can also actually use AI to try to identify your own bias. You could put an excerpt, maybe your behavioral observations from your report into an AI platform that's an appropriate platform for that purpose and ask it whether there's any indications of bias. You could ask the AI, based on this writing, how do you think I feel about the person that I evaluated? And you might get some really useful feedback from that. I've taken all the information from my website and I've put it into AI and I've asked it to describe by tone of voice, whether there's any indications of error, if there's any indications of inconsistencies or biases and so forth. And it's been extremely helpful. You could also consider doing the same thing if you have a practice policy manual, or if you have an internship or a fellowship, maybe give it the manual or your advertising and ask for it to give you critiques, ways to improve it. You could also give your reasoning for an opinion to ChatGPT, or maybe not ChatGPT, maybe some of these other AI platforms we're going to discuss in a little bit. You could use ChatGPT if it's fully de-identified. But you can provide this to certain AI platforms and essentially ask it to prepare a cross-examination for your report, for your opinion, and the support you have for your opinion. And that could help you to, if you haven't submitted the report yet, that could help you to refine your report. If you've already submitted it and you're waiting for testimony, it can help you prepare for that testimony. You can also use it for research. So elicit and consensus are two of many such examples, and I'm actually going to demonstrate them later on in this presentation. But if you do literature reviews for some of your cases, which I do, this is really helpful for improving your ability to find the most useful studies or articles for your reports that you're writing. And then a final one here is idea generation. I'm always looking for new ideas. That's why I attend workshops and presentations. I read books. I consult with colleagues. I Google different things that I need information on. But increasingly over the last 2 years, I've been asking AI for additional ideas. And so I'm sure many of the people in attendance here have already tried this before, at least in their personal lives. And I think that it's a great use of it. So can you use just any AI platform? If you are making social media posts, probably. As long as, again, it's creating accurate information, it doesn't really matter what you're using. But increasingly, clinicians are wanting to use AI for other purposes. For example, for writing part of a history section for a report. And if that's the case, then it absolutely matters which AI platform you are using. And there are some guidance that we've been provided. APA has an AI tool guide from 2024. And you might be thinking, 2024, that's 2 years ago. In AI world, that's like a million years ago. Is it still relevant? And I'll just tell you, yes, actually the guidance that they provide is excellent. It's still very relevant. I highly encourage you to read it. They have a companion checklist that's very helpful as well. But just to very briefly summarize some of the key considerations that they highlight is HIPAA compliance, data security, privacy policies, their clinical evidence of safety and effectiveness, and that's especially true if you're trying to use it for some kind of an interpretation. How long the company is going to retain the data and where it's stored, and you might be considering for that especially what country the data is being stored in. You would want to know, does the company share data with third parties? Does the company sell data? And is that company going to use that data to train their AI model? And just so you know, especially for these last three, if an AI company does not explicitly tell you that they do or do not do these things, you could probably assume that most of them are doing these things, especially the last one. If an AI company doesn't explicitly tell you that they do not train their AI model on the data you upload, they are using it. They want as much data as they can. That's what they use to improve their models. So you should assume that they're using it, which is a great reason not to upload your medical records or legal records from your cases to ChatGPT. ChatGPT will train on it. ChatGPT is not HIPAA compliant. It does not do a BAA. So you want to be very, very careful with how you're using it. And for what it's worth, I actually asked ChatGPT if it thought if there was any problems with a forensic psychologist using ChatGPT and uploading this information to it. And ChatGPT said that there is no problem with doing so in terms of the technology. The problem lies in the judgment of the psychologist. So you can think about that if you or your colleagues are using it for that purpose. If ChatGPT tells me that, it will tell the cross-examining attorney the same thing. There's also an ethical guide here from 2025 that APA published. This is for professional practice of health service psychology. A lot of what is covered in this is considered also in that 2024 guide that I was just showing you. But there are two other, I think, really important considerations that they highlight. And one of those is that you need to evaluate AI tools for potential biases. And you should use tools that disclose their training data source and provide evidence of validation. And that last one's especially important. You want to know which model, whatever service you're using, is based on. So for those who are not familiar, if you're using any of the AI platforms that I've discussed so far, almost none of them, or perhaps none of them, have their own large language model that they're running. What they're essentially doing is they are using one of the major ones, for example, Grok or ChatGPT or Gemini or Claude, and they are using those models. So you want to know what model is being used because that tells you things about error rates. It tells you about training data or where it might be sourced from. Another thing to consider is they could be using an open source model, and you won't know that until you actually have verified. And for those who are unfamiliar, most of the leading open source models right now are from China. And so you may again have concerns about privacy or about bias or about error or about training data sources, depending on what country or what part of the world certain information is coming from. So just make sure that you know where it's coming. So now I'm going to demonstrate how you would go about determining whether or not a platform is or is not appropriate for your specific purposes. I am not advocating for you using any particular platform. Again, I do not care which ones you use. I chose Bash and GPT today simply because I need to give you one platform as an example in order to use this as an illustration. Bash and GPT is specifically designed for healthcare professionals, which I think does have a certain benefit if you are a healthcare professional considering using AI for your practice. So I have my own checklist that I go through that I want to make sure any AI platform that I'm using for this kind of a purpose is going to stack up against. It includes a lot of what's in the APA's recommendations, but there's a few other things that I also look for and a few things that I've made a bit more specific that I think are important for us to consider. I'm going to try to walk you through this. It's very dry. It's very boring. I apologize for it. But if you are using AI for your practice or you plan on doing it in the future, I still think this is something that's really important to walk through. And if I go through this a little too fast for you, this is going to be on YouTube. You can always watch this again later. And again, as was mentioned earlier, a PDF of this is going to be provided to you. And you can, of course, review that in your own time. But HIPAA compliance, I think is important. Some psychologists would argue, depending on how you have your practice set up, what kind of work you're doing, if you're doing pure forensic psychology work, maybe you are under HIPAA, and that might be an argument to make. But I would say most of us, or many of us, are under HIPAA for other reasons. And even if you're not, it's best practice just to make sure that it's as secure as possible. And so I would, in general, be looking for HIPAA compliance. I would want a BAA, a business associate agreement. I would want to make sure that they are in compliance with any confidentiality laws for the country in which I am practicing. You also want to look at data residency. What I mean by that is, again, where is the data being stored? Like what country is it being stored in? So going through this pretty quickly, Bash and GPT is in fact HIPAA compliant. You can find this on their website. They're also compliant with a number of other privacy regulations, including for Canada and for Australia. Their plans automatically include a BAA, so that makes it pretty straightforward. And they say they do comply with all legal requirements for the US, Canada, and Australia. So that checks off our first three boxes. The fourth one in terms of data residency, if you look at their website for Bash and GPT, they specifically note if you have a US billing address, then they'll store and process all your data within the US. If your address is in Canada, then they'll keep it in Canada. If it's in Australia, they will keep the data in Australia. So that rounds off our legal and regulatory subcategory in terms of our checklist. And we move on to privacy and data governance. And I recognize there is some overlap between this and the first section, but I think this requires a more in-depth consideration. So one thing that I always want to look for is whether or not data retention limits are configurable or if they're present. And what I mean by that is if I'm uploading legal documents or mental health documents into an AI platform, I don't want it to be indefinitely available to the AI company. I would like it to have a set limit. In other words, after 30 days or 7 days or 60 days, it is automatically deleted. I also want an option to delete it immediately upon my own request. If I upload something that I think is particularly sensitive and I don't want it to stay there, I need to be able to remove it immediately, and now no one has access to it anymore. I also want the option to prevent model training on whatever I upload because I will absolutely exercise that option. I do not want whatever company I'm using to train their data on or train their model on the data that I am providing. I can just about guarantee you that the courts, the attorneys, or the people we are evaluating are not agreeing to us training our models on their information. You also want encryption. You can look at encryption both for in transit and at rest. In other words, is it being transmitted or not? And so TLS and AES are sort of industry standards. I would want to see at least this level of encryption. I also want to look at customer-facing audit logs. What do I mean by that? Anyone here who has used electronic medical records has probably seen something similar. In other words, if you go through the medical record, it will tell you who created what file, when it was created. It will tell you who last edited it or deleted it or moved it, if those things are even possible, depending on what system you're using. But I want to be able to audit this. I want to track this. Another thing that I want to look at is sign-on access. In other words, if a person gets your password, can they then just type it in and automatically access all the files that you've uploaded, all the data that you've uploaded? Obviously, that would be a huge privacy issue. So things like MFA or SSO are really important. That's looking at things like essentially having multiple steps in order to log in and single sign-on. Certifications are essentially looking at whether or not a third party has audited this particular company that you are going to be using the services of. So SOC and HITRUST are two of the most common. HITRUST is actually specific to healthcare. So that one is a certification that I am especially interested in when I'm reviewing different AI platforms. So I know that was a lot to go through, but these are some basic things that I'm looking for in whichever AI platform that I'm going to be using. So how does Bash and GPT line up with this? So first, GPT specifically says that they do not have a memory beyond what is stored within individual conversations, which is important for me. The data is never used for training AI models, and it makes no claim to any data that is provided. It also says that they automatically delete all chat history after 30 days, and you have the option to delete anything you like immediately. It also mentions here that they do not share your information with any third parties except Microsoft, which is the way that they have their system set up, but they do have a BAA with Microsoft, which allows them to remain HIPAA compliant. They specifically said they do not provide the chat history to OpenAI, and ChatGPT is not trained on the information that you give to Bastion GPT. So that checks off our first two boxes. In terms of encryption, they meet the industry standards, so that is in place. In terms of audit logs, this one's a little bit mixed. So if you look on their website, what they'll tell you is that the audit logs are internally monitored by their security team, and you can request them. So for me, ideally, you would be able to access that directly yourself at any time that you wanted to. So because it is available at request, I would say overall it is present. But maybe not as accessible as I would like it to. So the last one, I gave it a checkbox here, but I see it is a little bit mixed. In terms of the sign-on and certifications, depending on which subscription you have with Bastion GPT, you can have the single sign-on, or you can also have the multi-factor authentication as well. For certifications, they actually operate on infrastructure that has been certified or tested for both SOC and HITRUST. So that checks off those boxes there. And we move on to forensic appropriateness. This category is one of the more challenging ones to evaluate. But one thing that I want to make sure is that I don't have to upload identifiable data. Another one is that the outputs are reproducible. And what I mean by that is there are some AI platforms for whom if you ask it to summarize something 5 different times, it will give you 5 entirely different results. If you ask it a question 5 different times, it'll give you 5 fairly different results. If it gives you different results every time, how can you rely on it? There needs to be some degree of reproducibility or reliability for our purposes. I also need to see evidence of error rates or hallucinations or bias. That one's especially hard to evaluate, but I do need to have some kind of information, especially if there was ever a Daubert challenge or the appropriateness of the use of AI was taken into was challenged in some way. So for Bastion GPT, I'm looking at these 3 different points. First, there is no requirement to include PHI, so that keeps things simple. Second, there's not really a great way to quantify reproducibility, but I have done my own testing on the platform, and the variance is fairly minimal. When you give it identical prompts, it'll give you very, very similar results pretty consistently. So I don't have a way, again, to give you exact numbers on it, but overall, it does seem to be reproducible. As far as error bias goes, again, it's pretty complicated to look at. Something that you can use is something like Vectara, which has a factual consistency evaluation model. Essentially, what they do is they give all the major AI models a bunch of information that they need to summarize. And they look to see how many errors or how many hallucinations are in that summarization of a source document. And so feel free to go and look at the actual original article because they look at a lot of different models. I've only included 4 here as examples. These 4 here are all in the single digits, which is a positive. But I will mention part of the reason why I chose these 4 is these are 4 with 4 of the lowest hallucinating models that are in their study. So there are some that have much higher rates. So just make sure that you're aware of that. Another key thing here, actually, that I think is interesting, for those of you who have been following AI pretty closely for the last, maybe, let's say, year and a half, a year and a half ago, the hallucination rates were closer to 30 to 40% for a lot of major models. And if you didn't know that, yeah, they have been extremely high in the past. They are coming down quite a bit, which is also, I think, makes me more optimistic for the future that they've been able to improve hallucination rates so much. But of course, the hallucination rate is not zero. And if some of you are already using AI and you have not detected hallucination rates, it just means that you're missing every single hallucination. So it really calls for a great degree of conscientiousness and thoroughness. I guarantee you that there are hallucinations in the output that you're receiving, and you're just not able to identify it as such. So why does that matter? Well, the reason why it matters is, as APA says, we need to know what models we're using. And so Bash and GPT says on their website that they use ChatGPT, Claude, and Gemini, which the ones that I gave as examples are from ChatGPT, Claude, and Gemini. So if we're trying to see what is the error rate, what is the rate of hallucination, and we know that Bash and GPT is using these models, we might conclude it is probably somewhere around those hallucination rates, but there's not a way to specifically know. And so there's a positive and a negative to that. On the one hand, we have a general sense of potential error rates, but we don't know an exact error rate. And I actually reached out to Bash and GPT because I was trying to get more information about error rates. That's really important to me. What they told me is it is really hard to quantify for a few reasons. One reason is that they try to select different models for different tasks. They try to match the model that's the best at certain tasks. So depending on what task you're giving it, it may be using a different model. So that makes it really complicated to determine exactly what the error rate is. Their argument would be, well, we are using the different models for different tasks because it is essentially maximizing the benefits of the different model strengths. So, that would be the pro, but again, the downside is we cannot possibly know exactly what the error rate is. Another challenge is, if you're keeping up with AI news, you know that there is news for AI every single day, and there are new models for these major platforms coming out every week or two, which again means that there's new models that will be used, not just for Bash and GPT, but for any platform you're using. They're going to be switching to newer and newer models fairly often. And as AI progresses and becomes more advanced, the speed at which new models can come out is also increasing, which again makes it a little bit more challenging. The hope is that it'll be improving in a way that's consistently making error lower. So that's a positive there. But again, it's hard to pin it down. Bash and GPT has set parameters to further reduce hallucinations. There's a lot of different ways that you can try to reduce hallucinations yourselves. If you've ever read up on like prompt engineering, that'd be sort of an example. So Bash and GPT would essentially say you could assume that their error rates are lower than the stated just general model error rates. But again, there's no way to know exactly what it is. So it's a little bit of a mixed bag, I understand, and you'd have to kind of determine how low does the error rate need to be before I'm comfortable using this platform for a particular sort of task. One thing to be aware of is Google, which has Gemini, by mid-2026 has indicated that they will likely have a way to tell you how grounded the information it generates is. And what I mean by that is how likely is the information that it generates to be hallucinated or not hallucinated. And if we know that, that could actually be a really useful tool in further reducing error and identifying hallucinations and bias. I'll give you an example of what I mean. An example of that would be if you have AI summarize a document for you, a bunch of medical records, let's say, and at the end of it, it tells you that this person has an opioid addiction, but it tells you this is 20% grounded. what that's essentially saying is there is a pretty high probability that this was hallucinated because this may have been essentially fabricated based on this person's SES, their demographics, their utilization of the emergency room, and other characteristics. Based on these things that are associated with opioid addiction, the AI concluded that they had one and generated it, but it may actually not say that explicitly anywhere in the records. So that would be a great opportunity for you to go back to the records and double check it. And Bash and GPT says there's maybe a couple different ways that this could be utilized. One might be that those pieces of information that are more likely to be hallucinated could be highlighted with red text, or you may be able to set a threshold where any sort of groundedness or how grounded it is below a certain percentile or percentage, I should say, would be eliminated from the summary. So you could set it at nothing below 30% or 40% or 50%. So the important thing there is it could potentially further reduce bias in the future. So in terms of evidence for error rates, I give this sort of a mixed output or a mixed result because it is really challenging to pin it down within a narrow range. Another category is business, operational, and contractual. And so what I'm talking about here is that the terms of service should not prohibit forensic or legal work. You need to have clear ownership of uploaded and generated content, and you need to have the ability to have good support if you need that support. So I've reviewed their terms of service. It does not prohibit forensic psych work or use. It makes no claim to any of the data you provide. And in my experiences, they've responded pretty quickly when I had questions about whether or not they were going to meet certain requirements or guidelines that I have for my own use of AI. So I would say that those three things are checked and we can move on. All right, so how can you use it? I'm going to give you an example here. You could actually use it during an evaluation. You could actually record the session. And again, you would need to get a permission from the appropriate parties in order to do so. But assuming that you have permission to do so, you would hit the start recording button here, and it would give you a record session option. You would type in the information that you need in terms of the title. You hit start recording, and then that's it. It's going to record your session. When you're done, you hit generate transcript, and it's going to give you the session in a queue. I'll just tell you that if you are recording lengthy sessions that are multiple hours long, it will take a very long time for it to transcribe everything. So just go work on something else while you're waiting. And when you come back, it will have a nice transcript. And so I made a little sample transcript for you here, so I wouldn't have to use an actual interview. But here you can see that I have a fairly short recording that I made, and there are only 2 errors in this, which means that this is a 97% accurate transcription that I made. I also made a second one in which I interviewed another person for this presentation today. And the nice thing is as you can see, is it identifies speaker 1 versus 2, which makes it a lot more clear. It's easier to organize what is taking place in the interview because it will recognize the voices. And in this, there are, again, just 2 words that were inaccurate. It added the word of, and it added the word well, but otherwise it was accurate. If you look at the top here, you can see there are other options. So one of them is summary. So if you hit summary, it automatically gives you a summary of the transcript, which is a very nice feature. If you hit SOAP note, it gives you the SOAP note. And as you can imagine, detailed SOAP note is just an even more detailed SOAP note. And this is just part of the subjective aspect here that's bulleted out, going through different symptoms and subjective experiences that were reported. But I think the most useful one potentially for practice is a custom note. And in a custom note, you can essentially tell the AI how you want this note to be structured, and it will automatically fill in the information as appropriate. So as a demonstration for you, I asked it to create a history section with educational history, occupational history, substance use history, and mental health history. And as you can see here, it just automatically created that history for us. And I read through this. I actually did not see anything here that was hallucinated. So that is a positive for our demonstration. But you can also actually upload your own report formats or a supervision note format or whatever format you're looking at, and it will use that to essentially organize the information you have. So if you did have, again, everything in place, ethics, permission, etc., and you wanted to start using this to write history sections for your report, you would have just essentially finished the interview, you would hit transcribe, you would wait for it to be done, you'd have your custom note, and it would automatically have this for you. The next step, of course, is you would read this in detail to make sure that every single point was correct. There were no inconsistencies or inaccuracies. You could actually also ask AI to double check to make sure there's no inconsistencies as well. But I still encourage you to do that yourself as another check. And that might free you up to spend more time focusing on diagnostic opinions, forensic opinions, and support for those opinions. You can also use Bastion GPT for the purposes that I was describing at the beginning. You can use it for supervision notes, and it may be that you're not comfortable or you're not allowed to use AI to write your reports. And there's a lot of good reasons to still not use it for writing forensic reports. I am not currently writing forensic reports with AI. And there's a number of reasons for it. There's pros and cons. And it depends on your context and your situation. But you may still be thinking, I could use this for my supervision notes. Rather than having to write a note after every supervision session, I could have AI do that for me. If you do that, I would still encourage you to have an agreement with your supervisee and make sure that you have policies in place that allow for you to do that. But I think that would be potentially a lower risk or an easier way to get started if you have not already done so. You can also use Bastion GPT to critique or cross-examine your report. And since this is HIPAA compliant, it's something that's a lot safer. Again, if you have permission to upload this to AI. You can use it to identify inconsistencies across the documents that you have within your records and within your report itself. And you can use it to role play with trainees and students, like I discussed earlier. And I actually have an example for you here. In this example, I asked Bastion GPT as an example, why are you here today in this little role play? And it tells me that it's here for a Social Security disability evaluation because it's depressed. I asked it for symptoms of depression, and it lays it out way too easily. It basically tells me most of the criteria for major depressive disorder in the DSM in the most succinct, easy package possible. So I gave it some feedback. I told it, you're making this way too easy. You need to start over, make it a little bit more challenging for us here. And it actually responds to that feedback. And this is a very simple prompt. You can actually do something that's much more complex that will give you even better results and can be really helpful for giving students essentially unlimited practice before they actually have to start interviewing people for a new type of evaluation or maybe for an evaluation for the first time. All right, we're going to move on to Elicit. You can use Elicit much like maybe you've used PubMed or Google Scholar or EBSCOhost or different research platforms. The benefit, though, is this is going to be using AI. I asked Elicit what the average IQ is of people who are restored to competency to stand trial versus those who are not restored. I will often have to give opinions on restoration, prediction, and this could be an important consideration. When you do that, it gives you a table and it quickly summarizes each of the most relevant studies, and it will give you what they call a summary. The summary is really an abstract of the abstract. It's one or two sentences of each of the abstracts. But one of the best things I think about Elicit is the ability to customize columns. And I'll show you what that looks like. So right now we only have two columns. We have the paper column and the summary column. But if I want to, I can tell it in this column, I want to know what country the participants were in. You just type in whatever you want. You hit add column, and ta-da, we have a location column here. I can then say that I want to know how many participants were in the study. I hit add column, and now we have a sample size column, and it tells me how many were in each study. You'll notice down here, it doesn't mention what countries they were in, and that is a limitation. It will only be able to tell you information in a full text document that's available, or if only the abstracts are available, it can only essentially find the ones that have the information you're asking for in the abstract. So that would, of course, be a limitation there. But what I find is it helps me find the articles that I'm more interested in more quickly than when I use other search engines. It also has a link or a place here that you can copy the DOI, which then you can use to find the original article. And again, never rely on AI to just do it for you, to just summarize it and assume that it's 100% accurate. You need to go to the primary source, actually review that primary source, and ensure that it says what the AI said it said. And that's what this is what I'm actually going to be using when I'm writing my report, is the actual study. Another nice thing here is it has a history. So if you have prior searches that you've done that were really helpful for you, it's very easy for you to go back and find them again. And this will be the last thing I'll talk about for Elicit, is it can produce a research report. And what that is going to do is it's going to look at those top search results that it obtained for your question, and it's going to compile it into a single report that you can review. So you can see here, it's giving me a window. It shows it's screening the sources. This is a window showing that it's extracting the data. This is a window here as it shows that it's generating the report. And now we have the actual report. This report was 8 pages, and it only took a couple minutes to create. So it can potentially cut down on the amount of time you spend trying to review the literature. This kind of shows that the title as a question, it has its answer, it has an abstract. It'll give you results tables like these, and then it'll give you the body of the actual paper, so to speak. Here it's looking at population-specific patterns, clinical implications for threshold effects, and recommendations. Yeah, again, there are going to be hallucinations in this. I would just expect there to be some. So the idea is really to help you be more efficient in identifying the sources of data that you're going to be using for your work. We have one more that we're going to do. This is going to be our last demonstration for today, and this is consensus. Consensus operates in a somewhat similar manner. It's going to help you with research for your literature reviews. Here I asked it to differentiate psychosis from schizophrenia and psychosis from methamphetamine intoxication. And the first thing it does is it automatically creates a summary, summarizes the differences between them, and then you can see that it has its citations. So 1, 2, 9, and 10 means that down below, where it lists all the different sources, articles 1, 2, 9, and 10 are where the AI got this information from. This next line here is coming from articles 1, 4, 9, and 20, and so forth. Here's the articles for negative and disorganized symptoms, course and context, and so forth. When you click on the article, the little link to see what it was showing me, or where the information came from, it'll open you this window here, and it's very easy to then click on the PDF to get the full text. As another option, you can also click on it for the abstract. And that way you don't have to exit this window. You'll stay in the platform while you still have the abstracts. You can click through these and read through them pretty quickly, which again just speeds up your time. It's really about efficiency. It'll create tables for you automatically that organizes some of the differences. And then it, of course, gives you the list of the different articles that it's relying on. I think one of the greatest strengths of consensus is when you ask it yes/no questions. So that first one was not a yes/no. Now I'm going to ask it a yes/no question. I ask, is the Flynn effect reversing? Yes or no? And now you see why it's called consensus. It's going to tell you, based on its review of 20 articles, what is the consensus in the field? And of course, you may want more than 20 articles. You can, of course, look for more. But based on 20 articles, they found that there is about 53% said yes. They actually looked at 19 articles for this specifically. One said possibly there's a reversal. One said, or 4 said that there was mixed results, and 4 said no. And again, down below, you're going to see that it gives you all the different citations, but it'll also break things up into different categories like this in this table. So you can see that the average article that said yes, that is reversing, was published in 2019. The average article that said no, it is not reversing, was published in 2016. You can also see that those that said yes had more tier 1 studies and had more citations than those down below. So it's a really interesting way of visually looking at some of these questions. This is something that it just automatically generated as well. It's looking at 50 different studies that considered the potential Flynn effect reversal, but it's doing it across a timeline. It's showing you chronologically where these occur. And the color coordination here is based on whether it was saying yes or no or mixed or possibly. It also makes the question more nuanced in this table. So if you were to phrase the question as the Flynn effect has reversed or stagnated in several developed countries, they would say it has strong evidence. If we're saying several developed countries, it gives you its reasoning and the papers behind it. However, if you were to phrase it very differently, if you said, what is it, a global across the board phenomenon? It would say that this is a weak way of phrasing it. It's not as mixed, it's not as supported, and this is the evidence for that. And of course, this has other ways of phrasing that particular question. It also gives you this research matrix here. You can look at region versus type of IQ that was being considered. And so again, you need to go back and read the original articles. This does not replace you actually reading it and doing your own due diligence, but the benefit is being able to see an enormous amount of data very quickly and helping you to zero in on the things that are most important for you. So we'll talk about some pros and cons. One con is AI cannot write as well as some forensic psychologists. And then the pro would be AI already writes better than some forensic psychologists. The way that some psychologists can write and reason is still significantly better than what AI can do. But I'm sure we've all seen reports where we thought, AI would have done a much better job and much faster. And so right now we're at this interesting point in which AI is already surpassing many individuals in their own industries, in their own fields, but hasn't surpassed all such individuals. And of course, it still has errors and mistakes, which leads us on to the next con, which is it makes mistakes, it makes errors. You could also counter that and say, well, it makes less errors than some psychologists. And that would also be a very valid point. Um, and so there's a lot of, I think, mixed pros and cons here. The same thing is true for bias. A lot of people are afraid about the bias of AI, and I think that's a very reasonable fear, and we should be thinking about that. The counter to that would be, well, but aren't the people biased as well? And if anything, maybe AI could help us to reduce or mitigate some of our bias by asking it to critique us. Um, or you could counter that and say, well, I'm biased using a bias tool. How is that making things better? Isn't that just compounding the issue? And of course, you could counter argue that and say, well, how is that different than our psychological tests, which also include error and also have bias? And we are, of course, biased people using these tests, which themselves could have error and bias. How different is it? Um, so you can go back and forth. I think there's a lot of pros and cons. I think there's a lot of really important ethical and legal considerations. And again, Dr. Hodges will be going into that even more in his presentation. Um, we have to be aware of hallucinations. And I think a potential con is if you're being really conscientious and double checking every single point that AI generates for you, is it even saving you time? Would it take you maybe more time to double check every point that it generated than it would take you to just write it yourself? So those are, again, really important considerations for you. A pro is that AI is almost always better with typographical or grammatical errors. There's no flip side to the other. It's just a pro. People are generally much worse at writing in that regard than AI is. Another issue is reproducibility. For a basic clinical question every time you ask, especially depending on how you phrase it. So that is, again, an issue to be really aware of and to be careful about. There's some great articles. Tess Neal has one, for example. Terry Cooker has presented on this a lot. If you ever look at his presentations, there's a lot of great ways to reduce our own bias and our own error in our work. It's very challenging for us as individuals to directly impact the large language models bias or error. The way we use it can be improved in terms of trying to mitigate bias that way, but we can't directly impact some of those things. And so that is, again, a limitation. Last sort of set of pros and cons here. AI provides timestamps for transcribed audio and video. It could speed things up a lot for you. But if all you're doing is you're just reviewing that instead of actually listening to yourself, you can miss some really important things. If you miss something important and they ask you on the stand, why weren't you aware of this? And your explanation is, well, I actually never listened to any of it. I just had AI summarize it and it didn't point that out. It isn't going to go well for you. AI is a great tool to double check, but it is not a replacement for you. So the way you use it, I think, is extremely important. I think AI is getting to a place where it has a lot of utility, but only if you use it the right way. So here's my summary for you. There is risk in everything we do. If you are supervising a graduate student, you've taken on risk. If you're using psychological tests that have some error, you have taken on risk. If you're using dictation, you've taken on risk. If you're using Grammarly just to improve your grammar of your writing, or you're using interpretive reports from a psychological test that you used, there's risk in everything you're doing, just like there's risk in using AI. So the question is not, is there risk? There absolutely is risk. The question is going to be, are you able to use it in the right context, in the right way, with the right guidelines, the right protections in place, such that you can mitigate that risk and then emphasize the benefits. I think there are absolutely ways that you can use AI in which are justifiable, which are ethical, and which can improve the quality and the efficiency of your work, but you have to make sure that you're actually putting in the right steps in preparation for that. And that does take a lot of thought and work. And so presentations like Dr. Foreman's and Dr. Hodges will help with that a lot. And again, just making sure that you are doing your due diligence in preparation. And if you stayed through this whole presentation with me, I really appreciate it. I know I went through it very quickly. There's a lot of information that I wanted to cover, but this will be available on YouTube if you want to review certain pieces of information that I may have gone through a little too quickly. But thank you very much for your time, and that's my presentation.
Yes, thank you so much, Dr. Silber, for going through some very specifics and some practical considerations for all of this. A lot of this is reminding me of a lot of questions that I would have with trainees where they would ask if a psychological test or psychological instrument was valid. And I would say that the next part of that question is valid for what, and thinking about not just this global thing of can we use this or not. You're thinking about why are you using it, how are you using it. So thank you for pointing that out and all the different ways that this could be highlighted. As you mentioned, this is part 3 of a 5-point presentation on AI use. I'll just give the plugs as a heads up. The next presentations on AI will be with Dr. Tally Armstrong on February 17th, and then Dr. Heath Hodges on March 31st. In the meantime, we have a number of questions here. Of course, you can enter other questions as you'd like. I will not be able to get through all of them. The chat box also includes the link for the APA Continuing Education survey, so you can go ahead and make sure that you complete that if you're looking for APA CEUs. Somebody said that their state is requiring that people disclose any AI use, write precisely what was imputed, which AI they used, the degree that AI contributed to an opinion, etc. Can you speak to how you document or how you consider documenting or tracking your use for your evaluations about AI in your reports, if you do?
Absolutely, yes. And those are really important considerations for a number of reasons. Even if it's not required by your state, I would actually encourage you to utilize those guidelines because they are very important. So first, I'll say I'm actually not currently writing reports using AI. That's more, I'm not saying that no one can. I know some people are. I think there are ways that you can do that ethically and practically. For where I am currently working, I don't think Arkansas, with the kind of cases I'm doing, is ready for it. So I'm not currently doing that. However, yes, I think what you need to do is download all the input and all the output. That's extremely important for a couple of reasons. One is if you're using something like Bash and GPT, it's going to automatically delete it, and then it's gone. And so in order for the other side to cross-examine you, they have to be able to see that information. They have sort of a right to kind of see what you were using in your use of the AI. If you're using AI, you should fully expect there to be questions about how you're using it. And so you need to be able to fully demonstrate how you set that up. What was the second part of the question? There was the issue of documenting the input and the output. What was the rest of it?
Yeah, it was essentially how do you recommend documenting or tracking your use for evaluations, or how do you write about AI in your reports?
Yes. Well, yeah. So like I said, I'm not writing about it now. If I was to start using it for my report generation or a portion of it, I would specifically say what did I use? In other words, was it Bash and GPT as an example? I would also want to be specific about what part report and to what extent or what degree it was used. So in other words, if I only use it to write up the family history, then I'm going to be specific about that. In terms of conclusions, I would not use AI to generate a conclusion. First, actually, if you ask ChatGPT, for example, should I use AI for conclusions? It'll tell you no, you shouldn't. It cannot replace your judgment. But even if AI didn't itself say that, I think that it is way too early to do that. You are the clinician. You need to be making your own independent decisions. AI should not be replacing your judgment and your opinions. And so it could be helpful for gathering information, for verifying information, for double checking information. Don't let it do your job, or you'll be replaced.
You mentioned some issues related to cross-examination. Somebody else asked, during cross-examination or deposition, have you ever been asked to explain all the ways you used AI to prepare for testimony?
No, I have not been asked that. That would be a great question. I would be comfortable with that kind of question, though. I see it as being very similar to me asking a colleague to practice with me, to point out potential critiques or criticisms. If I asked AI to do the same thing, I'm totally comfortable with explaining that. I think it's a great exercise. It's a great practice.
Wonderful. A couple of people, when you brought up the transcription from Bastion examples, some asked about some circumstances that you found it more or less effective. So I'm merging a couple of here. Specifically, somebody asked if you've noticed more errors using transcription feature for patients that have disorganized or rapid speech Somebody also asked, do you find there's differences in the qualities when the speakers are in the same room versus remotely?
Yes, and you could also consider things like accents or speech and various speech disfluency or speech impediments or anything like that, like speech sound disorder. All those things are going to impact the accuracy. So there are some cases in which you might think it is not valuable to actually use it at all. It might actually produce so many errors, it's simply not going to be worthwhile. If you have a person who's manic and has very pressured speech, it probably cannot keep up with that. And so the number of errors would be so great it's not useful. That being said, if they're manic, I can't keep up with them either. So there's going to be multiple issues there. One thing I'd also add on to that real quick is if you are doing this transcription and the court or the opposing attorney finds out, you should expect them to ask for that transcript. And so then you would have to be able to provide that. So, the pro is now you have a transcript. The con is, hey, everyone else now has a transcript too. And are you comfortable with that? Is that something that you are willing to do now as part of your practice? If you start using it, are you using it only for certain evaluations? And can you explain and justify why only certain people get this, but not other people?
And taking a step back, several references to AI hallucination. Somebody asked if you could elaborate on what exactly is an AI hallucination.
So it's routinely referred to as a hallucination. If you look up, anything in the literature on it, I would actually say it is more consistent with a confabulation. If we're using more precise psychology terms, what it really is a confabulation. Essentially, there is kind of a space in which the AI is essentially filling in information. It's filling in the gaps, much like we would confabulate if we had a dementia or something along those lines. And it's inserting a piece of information that is simply not true based on a number of potential factors. So the example that I gave earlier about AI reviewing a person's medical record and based on that concluding opioid addiction when it's not in there would be an example of a hallucination. It simply wasn't ever said. I'll give you an example. You can ask AI, I want you to, well, I mean, some of the most common ones that have been in the news is AI will draft legal documents or research documents that has citations, and those citations go to nothing. Those citations don't exist. There's no such study. AI knows that when you have a study, you need citations, and it knows that the citations have to relate to whatever it is. It knows that there should be a year, there should be an author name, there should be a journal article name, there should be a title. And so it just creates it. It didn't find it and add it. It just made it up because it knows that that goes there.
Wonderful. Thank you for that. You mentioned different parts of a report and different considerations related to AI use with considering with reports. And somebody asked, are you concerned about students that may use AI to write their reports? How do you monitor this behavior? And of course, you could focus on particular sections of the report for your response too.
Yes, I actually have an AI policy in my private practice. I have graduate students here, and I do not allow them to use AI. And not because I don't think AI is useful or practical, but because I want them to learn how to do this themselves. I think that if you are a seasoned clinician who's starting to use AI as a tool, it can be a legitimate tool. I think if you're a graduate student who has not yet learned how to do some of this clinical work and you start using AI, it quickly becomes a crutch. And I don't want my students to be hamstrung by the use of a tool that essentially did their work for them, so they never had to learn to do it themselves. There's already research on people using AI having decreases in critical thinking, abstract reasoning, their ability to reason through problems. Their memory for things that they've created is significantly less if they're using AI to generate it. It's a very different mental process. And so I don't want that to happen to my trainees. If they get licensed, they're fully capable, and they start to use AI as sort of a supplement to further improve their work. I think that's great, but they need to build the foundation first.
You mentioned several different programs. I think some people are more familiar with some than others, like ChatGPT. Somebody asked for some of these other ones that you mentioned, like Bastion, Elicit. Do these programs cost money? If so, like what's a rough range of cost?
Yes, unfortunately, they do cost money. Some like Consensus, there is a free version. Elicit has some free credits, so you can use them for free for a while, and then eventually they're going to want you to start paying for it, which is fair enough because they're paying for it. So yes, those you have to pay for after a certain period of time, but you can use them free at first. Others like Bastion GPT I think you can get a 7-day free trial with Bash and GBT, and then you have to pay. As far as price range, I don't remember. I think Bash and GPT ranges from maybe like $20 to $60 a month, depending on which subscription package you use. Um, and that's similar to a lot of others. There's one called School Psych AI. And as you can imagine from the title, a lot of school psychologists use that to generate content for the reports. I think it has somewhat similar pricing. So I'd say that depending on what platform you're using, I would say that most of them run from $10 to $40 per month. And I should say, depending on if it's like Bastion, it's per month per user.
Dr. Silber, thank you so much for this thorough overview, as well as some specific ins and outs and practical examples of the potential for AI use and misuse in forensic psychology. We know a lot of our attendees have been very interested in hearing more here. A lot of the Q&A responses have been just thank you for this useful information. They plan to pass it on to their colleagues. Thank you for answering their questions even before they actually ask them and all that. So yes, thank you so much for all of this information and the groundwork that you've done for helping us in the field understand how AI could be used or misused in the work that we do. So that does wrap up this week's Law and Mental Health series. Again, as a heads up, next week's planned talk will be rescheduled. We will return the following Tuesday, January 20th, with Dr. Colleen Berryessa discussing criminal legal outcomes for people with autism spectrum disorder. We hope to see you then for another great discussion of issues in behavioral health and the law. Until next time, take care.